CDC, in 2006, 4.5 million children were diagnosed with ADHD. Approximately 56% of these children were undergoing treatment using medication. Medication is not the only answer to treating this disorder. Today, many alternative treatment options are being considered and tested. ADHD, also known as Attention Deficit Hyperactive Disorder, can be broken down into three groups: hyperactivity, inattention, and impulsiveness. A person with ADHD may have symptoms of one of these groups or a combination of each. Symptoms for hyperactivity include being fidgety, non-stop talking, constantly moving, and having trouble sitting for long periods of time. Inattentive children have trouble focusing, can be easily distracted, have trouble listening and following instructions, and seem to daydream and become confused frequently. Symptoms of impulsiveness are impatientness, interrupting conversations, and show emotions without restraint. Let's take a look at what it's like to live with ADHD. Here we have Michael, or otherwise known as Mike Skullman on YouTube, who was diagnosed with ADHD as a child.
So here's an example of what it's like to be inside my head. Most people will look at the sun and think something like,
"Oh, the sun! How wonderful! How warm and bright!"
Whereas I would think something like,
the soft X-ray flux of X-class solar flares increases the ionization of the sun, which can interfere with shortwave radiation.
Man, that baby in the sun on that Teletubby show really freaked the crap out of me.
Like with the sun being all symbolized by the Earth.
Man, I would really like some lasagna right now.
If I was king, my symbol would be a big badass dragon. I hope the sun stays out long enough for me to finish chopping all this wood and insulating the basement and carrying rocks or emptying out the water bucket. That was indicating a velocity of approximately 1/3 light speed.
Genetics, brain injuries, and food additives are just some of the things scientists look at in children that may have symptoms of ADHD. Nicotine and alcohol use during pregnancy have also been linked to ADHD symptoms. There is no concrete set of causes of ADHD, but many ADHD patients tend to have thinner tissues in the areas of the brain dealing with attention, and some children have smaller cortexes which controls thought and action. People with ADHD tend to have lower levels of dopamine. Dopamine is a neurotransmitter in the brain that carries information to the cells. Lower levels of neurotransmitters can have an effect on attention and focusing. Problems with attention and focusing are two symptoms that ADHD patients have. ADHD is not curable, only treatable. The most common way to treat ADHD today is medication. Many doctors prescribe psychostimulants. These drugs usually are used to stimulate, but they have calming effects on ADHD patients because they increase neurotransmitters in the cortex. Some of the most common stimulants are Adderall and Ritalin. Patients that do not respond to stimulants may get serotonin norepinephrine reuptake inhibitors, or SNRI. These are used as antidepressants that increase the neurotransmitters serotonin and norepinephrine. Many parents are against medicating their children at such young ages. They are afraid of drug dependency developing later on in life. Symptoms of stimulants are also closely monitored. These include insomnia, decreased appetite, or repetitive actions such as rolling their head. Children may also experience a personality change that can make them seem zombie-like. A study done by the Pediatric Nephrology and Hypertension Center at the University of Texas Health Science Center and Cardiovascular Clinical Research in Delaware discovered the use of stimulants in children is linked to the increase of blood pressure. Increased blood pressure can be a risk for cardiovascular issues later on. SNRIs have more serious side effects such as anxiety, dizziness, nausea, changes in vision, headaches, and/or liver damage. Lowering dosage levels can help these side effects, or other drugs will be prescribed to help. This is another reason parents don't like medicating their children. In the end, they could be receiving 3 different medications, each to fix the problem the drug before it caused. Alternative treatment options have become popular in recent years. While many specialists still believe medicine is the only way to treat ADHD, some are agreeing medication paired with other treatments do seem to help and can lower dosage levels of medication. Some of these alternative treatment options include psychosocial counseling, special diets, and parent training. Let's take a closer look at each of these. Psychosocial counseling helps behavior modification. Here a reward system is used to help with behavior. Children receive rewards for positive behaviors and either do not receive a reward or have something taken away for negative behaviors. TV privileges for completing homework would be an example of this. Meditation has also been looked at. Meditation helps relieve stress, which can decrease ADHD symptoms. It can help improve grades and behavior. Parent training is also a positive option in helping treating ADHD. Parent training teaches parents how to parent a child with ADHD. Parents learn strategies for disciplining and rewarding children. It also helps parents learn how to make life easier for children with ADHD. Things such as not giving them too many options of things to choose from, organizing their things for easier access, and not having distracting things on such as TV while trying to complete a task. Special diets include staying away from food with additives. Additives such as artificial colorings and preservatives have been linked to learning disabilities. Taking out food with additives may help children with ADHD. Staying away from sugar may also decrease symptoms in ADHD. A recent article in the Brown University Child and Adolescent Psychopharmacology Update discussed the use of omega-3 and omega-6 fatty acid supplements to help ADHD symptoms. It discovered omega-3/6 may help children with attention, motor skills, and perception. Though many of the alternative treatment options are still undergoing testing, there seems to be promise. Not all children may benefit from alternative treatment options, but it may help some of them have lower dose medication or no medication at all. Each little step helps to protect children from becoming overly medicated human beings.